Reports of whooping cough were lower than usual over the last few years, but now they're back to pre-pandemic levels. I'm community reporter Izzy Romero, and I spoke to a local expert about the rising cases and how you can protect you and your family.
2024, we had 18 confirmed cases within San Luis Obispo, and we've just started with 2025. We've already had 11 confirmed cases, and pertussis is usually transmitted in summer, early fall.
Whooping cough, medically known as pertussis, cases are on the rise in San Luis Obispo County.
First stage, it's going to look like a regular cold, flu. You're not going to know if it's pertussis or whooping cough versus any other influenza or other strain of RSV. What happens is in the second part of the symptoms with whooping cough, the most likely child we see it the most is they'll start having a cough that's really strong and making that sound where they're not able to catch their breath.
Community health nurse Brandy Likes tells me when her daughter had whooping cough as a child, it was a major challenge.
She had to have an inhaler for a good year afterwards, anytime with exercise-induced asthma.
Local preschool educator Cherokee Trent shared with me the struggles of keeping children in her classroom healthy since they are a vulnerable age group when it comes to diseases.
And constant reminders you got to catch your cough, which just means to put their cough in their elbow so that way they're not spreading their germs. But children obviously are still learning that, and it's a learning process, so germs do get spread very easily.
Likes says that anyone can get whooping cough, but infants and pregnant women are the most vulnerable. If you are expecting, Likes encourages you to get vaccinated.
And that will help the baby be able to have some protection until they're first able to get their first dose, which is at 2 months.
According to the CDC, the best way to prevent whooping cough is through vaccination.
1, 2, 3.
In San Luis Obispo, Izzy Romero, KSBY News.